Hi everybody, welcome to this week's video where I'll be talking to John-Barry, who hosts the On the Wards podcast. John's podcast is unique as he shares mental health patients' experiences in a secure psychiatric hospital. This fantastic podcast won a Nursing Times Student Innovation in Practice Award and was also nominated for a Royal College of Nursing Award. Firstly, it's no easy feat to create a podcast like this, for example, to gain authorization in a secure psychiatric hospital. And secondly, John does this podcast while working full-time as a mental health nurse. The idea for the podcast came when he was a student nurse, and he's going to be sharing how you go about setting up a podcast following his nursing dissertation. So it's helpful for anyone looking at setting up a podcast as well. And I've recently been highlighting several nurses and projects and a few more in the future on my YouTube channel. And for me, John is challenging people's perceptions of mental illness and the stigma surrounding a secure psychiatric hospital. As it says on the trailer for the podcast, people think about these psychiatric hospitals sometimes as straitjackets and padded cells, or the film One Flew Over the Cuckoo's Nest. John's podcast challenges these views, and I think this podcast gives people with mental illness a voice to express their stories, and you listen to their journeys and that these individuals have been on. So I, for one, love the podcast, John. It's authentic, it's real, it's about supporting people from all walks of life. So you can see I'm a great fan. Thrilled to have you. Thank you for taking the time today out of your busy schedule. Welcome.
No problem at all. I'm very pleased to be here. Very pleased to talk to you.
Thank you. So I thought what would be good, John, is just firstly, just to give a bit of an overview of a brief overview of your career to date.
So it's a long story, but we'll try and shorten it down. So basically, I was a support worker for many years, working in a secure psychiatric hospital. I attempted to do my nursing when I was about 25. But unfortunately, dropped out after a year. I found it very tough and very stressful. I'm sure some of your students will. What's the word? Recognize that. But anyway, went back, and I was very lucky that I was sponsored by where I worked. So I was given a sponsorship, was able to go and do my 2 years. I did a year of prior learning while at work. So was sponsored to go and do 2 years, went off to Northampton University, qualified as a nurse in 2019. And so I've been a nurse since then. So what are we now? It's about 4 years.
Yeah.
The pandemic messes everything up. I don't know. Yeah. Those years count double or what? I don't know.
Yeah, they should do, shouldn't they? Yeah. So so first of all, where did the idea of the podcast originally come from? When we met a few weeks ago, you were talking about being inspired as a student, and that will be really inspiring to our students. So if you could sort of...
Yeah, so well, essentially, again, when I was studying in Northampton, but I was living in Essex. So I was driving up and down many times up and down to Northampton, and so I'd listen to podcasts quite a bit because I'm a bit of a nerd. Listen to it on the drive up. And so I thought it would be a good idea, you know, to try and get patients on a podcast. So then you kind of circumnavigate some of the privacy things, because it wouldn't be filmed, but you would get to hear their voices. Because there's lots of kind of case studies and things like that where they're written down, or sometimes we have patients that have been in hospital and look back and kind of do audio. But I wanted to get patients who are in it at the moment and then kind of get their first-hand experience of what it was like in a hospital. But anyway, going back and forwards to Northampton, and our dissertation was a practice improvement plan. So I decided for myself to try and design a podcast.
I think the sound went a bit funny then. I think it's okay now, but yeah.
Okay, don't worry, if I sound like a robot, it's all right.
Yeah.
But anyway, so yeah, basically, our dissertation, my dissertation idea was to do a podcast, but I cannot say it was a good idea, and I wouldn't advise your students to choose it because I got the worst grade you can possibly get. It was a pass, but it was just a very bare pass. So maybe a good idea for a project just to do, but maybe not such a good idea if you're thinking about doing your dissertation.
Yeah. So some people might question you talking to people with severe mental illness in a psychiatric hospital.
Yes.
You know, they might view them as very vulnerable. What would you say to people questioning you actually doing a podcast in a secure psychiatric hospital?
Well, I'd say they're right to question it because, you know, we have to look after the patient's well-being. That's really important. But I felt like there's a lot of stuff that we don't do, particularly in mental health, because we're a bit scared of it hasn't been done. So there's a lot of that where we're a bit wary, you know, for good reasons. But also, we also have to recognise that the patients are just like us, so they have the right to appear on a podcast or use social media or do these kind of things as much as anyone else.
Absolutely.
And I think I spoke to you before, and I spoke to you. The people who are up for it the most were the patients. So some of the staff are quite apprehensive and a bit nervous about kind of recording. Like you say, it's not really been done before. I think at the time we weren't even allowed mobile phones through the airlock in our secure unit. So to bring like recording equipment and things like that, a lot of the staff are very wary and worried. But the patients were the ones who were fully on board. They really, really wanted to tell their story. And I think there's something in that they wanted to express, you know, what their lives have been like and what their lives are like. And the fact that I think one of the patients said to me one time, we haven't stopped, but life doesn't end once we go in here. We're still living, you know, we're still, because some of them are in there for weeks and months and for long periods of time, but they don't just stop their lives and then start again when they leave. They are living their lives once they're in hospital. And some of the patients are doing great things, you know, volunteering and making music and art. And it's tough. Like I can't, you know, being in hospital is very tough, but it doesn't mean that that's the end of your life.
Yeah. Isn't it fascinating though that nurses make those assumptions and it was the patients that were so positive? So let's look at setting up the podcast. So you sort of alluded to gaining authorization. You have to ensure that you're safeguarding patients. So did you get any difficulties gaining authorization? So for example, if I went to my hospital trust, I'm sure I just don't think I'd be able to achieve it. I mean, it's a massive achievement, but how did you go about gaining that authorization, and was there any difficulties?
Well, I think that the main thing was, like I said, getting the patients on board. So at the time we had patient forums and meetings where we'd meet patients from all across the unit and get them kind of fully on board first. So we had lots of volunteers there and family. And if you get the idea kind of germinating from them, so they wanted it. So then it was far easier than to go to kind of the higher up people and say, like, look, this is what they're asking for. And I think there is a bit of fear and apprehension, particularly, like I say, about something new. Kind of there was legal issues, so we contacted our lawyers and lawyers for Mind, and they kind of said the same things that kind of said to you, where as long as the patient has capacity and it doesn't do them any harm, they have the right as much as anyone else to agree. But again, you know, we still had to make sure that the patients were comfortable. We had to confirm it with their team, so their MDT and their responsible clinician, that they were well enough to do it and that it wouldn't cause them any harm.
I mean, and you've really explained the amount of, because that's a lot of preparation, isn't it? You did a lot of scoping and getting those views. It's not just, you can't just do these things. The authorization is so important. And, you know, you got all those voices from patients that sort of would have driven it, actually, wouldn't it? So,
yeah, and like I said, I think that's the main thing. If you can get the patients on whatever project you do, if the patients are on board and they want to do it, start with that. And then you have to go down the right route. So make it in, you know, minuted in community meetings and all sorts. Make sure that it's kind of documented everywhere. This is what they're asking for. It's not that I've, you know, kind of projected it and I want them to do it. It's that they're asking me if I can do it.
Yeah. And it's interesting because if they hadn't, you might not have even been in this position now, you know, if you didn't get that driver.
Oh no, I wouldn't have done it. Like if the patients weren't asking me to do it, there's no podcast without the patients, you know.
No. And it's really good that you mentioned about networking. That's so important as well, isn't it? Networking for any sort of change project like this. So
the other thing is, don't get disheartened, because you will get people that say, like, you can't do this. We don't do this here, and we've never done it here, and so we don't do it. I for one, I'm very open to. I think we need to be far more open as mental health nurses and, you know, teams, that we kind of close off all the buildings. So of course people are going to fill in what they see from movies and what they read in books and things like that. That's what they're going to think hospitals are like, because we've closed the doors, maybe for the right reasons. But we're in 2023 now. We need to start opening up a bit and show people what it's actually like. I mean, you can't. There's tons of documentaries on, you know, I know this is flippant, but, you know, Casualty and all these kind of programs featuring general hospitals. But you don't get many, you know, videos and media things featuring psychiatric hospitals.
And that's what I find so
unless they're very negative.
Yeah. I mean, that's what I find so brilliant, listening to the journeys of these individuals as well. And I think you are giving them a voice. And so tell me a bit about the actual process of setting up the podcast for somebody thinking about setting up a podcast, a nursing podcast or something similar, the key phases or stages.
I'd say it kind of goes in thirds. I'd say so you need a third of prep, a third the actual recording, and then a third is like the editing, if you like. And I'd say the last bit is probably the work. So the editing, as you probably know, Carol, is probably the most tedious and boring bit, but it has to be done to make it kind of sound right. The other two bits, so that the prep is quite important. So getting the patients in the right place, and that's why sometimes the podcast is a bit varying in sound quality, because you just have to roll with what you've got at the time.
Yeah.
So I think that's one of my main learning things from this is nothing has to be, you don't have to be exactly perfect. As long as you get the main gist of it and you get the voice out, that's the important bit. But I think if you were waiting for like the perfect audio in the perfect room, it probably wouldn't happen. So you have to do stuff a bit fly by the night and just do it as you see it. Yeah. But no, I think it's very important to do the prep, get it recorded, but don't be afraid to put it out if it's not 100% perfect.
Yeah, I mean, that's so true. I mean, with the YouTube channel, it's taken off a little bit, and there's a lot of students, and I guess it's the feedback I get, which is lovely. But I used basically PowerPoints, and I can't edit. I mean, I was talking to you earlier that I'm absolutely rubbish with anything like that. But it is a skill, isn't it? And maybe as nurses, we need to be looking at those sort of media skills as well in the future, I suppose.
I think so. Well, like the pandemic, we all had to start using Zoom and Teams and that kind of stuff. So we're all getting used to kind of editing and recording stuff and kind of going back and looking at it. And that's a very, that was very difficult for me. Trying to listen to your own voice is very hard, because you sometimes think, do I actually sound like that? Oh, God.
You've got a lovely calming voice, I think, on the podcast as well.
But yeah, it's very the technical side of it wasn't the hardest bit. I'd say it was more kind of getting the authorization or getting people to be on board. And I think once we'd done the first episode and the first recording, I remember getting the first patient's audio, and it was episode 1, and the guy spoke, and he spoke so well and so like kind of moving to me the way he was speaking that I thought, I have to get it out now. I owe it to this guy to kind of get this out and get it published, if you like. And I think once the staff had kind of heard the first episodes and they got the gist of it, they were a lot more on board. But I think getting that, everyone's a bit wary to start with, but once you do the first one and get it out, then people are like, okay, I see what you're kind of going for.
Yeah, absolutely. So out of all the episodes, which is your favourite podcast or patient interview, do you think? If you're going to advise someone to listen to one, maybe, or what's your personal favourite?
Well, I would say listen to episode 1, series 1, the first one, just because that kind of explains everything, and that's where we first started, and it was like kind of gives a brief overview of what I was trying to do and exactly kind of where the podcast was going. But I think my favourite one, there's one called the music episode. I think it was series 1, episode 3, I think, or 4, I forget. But it's all about music. And I just found it fascinating. I'm still fascinated by the kind of different way that patients would use music. So we had one patient featured, I think, who maybe was diagnosed with personality disorder. And her music was a lot more melancholy and a lot more sad and all that kind of stuff. And then we had another patient's music who was who'd been diagnosed with schizophrenia. And his music was just completely, it's just out there. But it was fascinating. It was beautiful to me. But it was so strange the way he'd recorded it. He'd recorded it like on a PlayStation using different snippets of sounds and all that kind of stuff. And it's the music teacher I spoke to said it didn't make sense, but it does. Like she said, it shouldn't come together and work in like a musical way, but it kind of does. And I was just fascinated by that, the way kind of his brain was thinking outside of the norm, if you like, and was able to kind of come up with these kind of weird and wonderful tunes.
I think to me as well, some of the episodes really moved me, and I think it's when you hear those journeys, but I think what you get across is the sort of the journey and then the positivity, because often they're going home, aren't they? And they talk about that journey going home as well, and the journeys and the struggles they've been on, but there's positivity there, and like with the music, and I don't know, it really moves you. Some of the so I would really recommend people sort of watching it.
It certainly does. I mean, it is kind of like I guess most of the patients featured would be kind of towards the better end of their stay, as it were. So when they first come in, they're kind of a lot more unwell. And so in order to feature on the podcast, they would have to be slightly better, just, because we don't want to feature people that maybe aren't quite appropriate or whatever. So you're right, it is like them looking forward, and a lot of them are on the way out. But, some of them not been out for years, and that is moving, I guess, to see them somewhere that they've been in hospital for, sometimes years and years and years. I think, like I said, the guy featured in episode 1, I think he was the one who mentioned about he'd gone home for the weekend or something like that. And he met someone he hadn't seen for a long time. And they said, "Where have you been?" And he said, "I've been to prison." And he'd rather say that he'd been to prison than say that he'd been in psychiatric hospital. And I didn't say anything, but I asked him afterwards. I said, "Why did you say that?" He said, I just get more, I don't get as many questions if I say I've been to prison than if I've been to that's kind of exactly what the podcast is about. It's trying to show people that, you don't have to be scared and ashamed of being in hospital, and kind of show a bit of what we're trying to do in hospital.
Yeah. And have you had any of them, I'm really interested to know if any of them come back to you that have heard themselves? Have they sort of fed back themselves of hearing themselves, or do they not?
Oh yeah, all the time. Some of them come back to me and say, like, one of them was saying that he's famous now because he's been on the podcast. And he's like, but they're fascinated by it, and they love the response they get from the public. So I get a lot of tweets and things like that, quoting the podcast. And one of them had a tweet from Russell Brand, the Hollywood guy, and he keeps it. He's printed it out and he has it, and he keeps it in his pocket. And every time I see him now, he's out now, and he comes back doing volunteer. And he goes, "Oh, John, I've still got the tweet from Russell Brand. Remember when he messaged me, and that was great." And so they're more infused by the response they get from people. And like when I say to them, "Oh, how many listeners has it had?" and I say, we're up on 20,000. They're like, "Oh, that's amazing! Like 20,000 people are listening to me." And I think they're more. I think it's great because it shows that people do care and people do want to listen and people are interested in their story, and not just kind of. Look, there's a lot of negativity in mental health hospitals, and I get it because they are incredibly difficult places to be, incredibly difficult places to work. Mm. There is positivity there, and there is people who do get better, and I think we do need to show that as well.
Oh, that's amazing. Do you generally, what impact do you think the whole of the podcast has had? Have you seen, would you say the impact is, just reflecting back? I don't know if you have ever reflected on it, but making reflect on it.
Yes and no. I mean, it's like I'd like to think from a micro level, if you like, it has helped some people. So again, I think I talked on the podcast that some family members would refuse to come in or wouldn't want to come to the hospital because they'd say, "Oh God, I don't want to go there. It's going to be all like people in cage cells." Like, I think there's a movie, Silence of the Lambs, where they're in the guys behind a cage and a mask, and they genuinely thought that's what the patients would be like. Yeah. And again, I don't blame people for having that opinion because we have not been quick enough to show people what it's actually like, or get them to listen to a podcast. And so people's family members are a bit more approachable to come in. If and patients have said to me, they will say to their family, "We'll listen to the podcast, and so you can hear a bit, about us, rather than kind of going for the Hollywood version of what hospitals are like." Yeah. So they're the ones that kind of infuse me the most, like the anecdotal little ones where the patients go, "Oh, my mum's come in because she listened to the podcast and she liked it."
That's amazing. So, I mean, that is challenging those assumptions, isn't it? As we talked about at the beginning, how important that is, isn't it? Because people, when you say secure psychiatric hospital, people make those assumptions from the media and
yes, and I think we're getting there. We're getting a lot better with mental health awareness days, and everybody's kind of on board with mental health really important. But I think that kind of stops when it gets to serious mental illness. I think people are very when we get to the lower level stuff, which is important. It is very important that people talk. But I think people are happy for that. When it gets to the more serious end, particularly psychosis and people who self-harm and things like that, people do have a reluctance then to talk about that or be invested in it, or just listen to people's stories about it.
Yeah, oh, it's amazing. I mean, I've learned so much as an adult nurse from, and I did a psychiatry in the 1980s. All students won't realise this, you probably will, John, but that all student nurses did 3 months in a psychiatric, and I was in an acute severe psychiatric hospital. We did a bit of midwifery, etc. And that gave me such insight, when I worked there as a student nurse.
Well, I'd say, to all the nurses that are going to be qualifying now, they're going to be seeing a lot more people with a lot more problems. Mental health services kind of scratch back to the bone, and the police are saying that they're not going to get involved anymore. So there's going to be a lot more people with mental health problems turning up at hospitals, and kind of in indirect routes are going to end up in working with general hospital patients. Nurses, sorry. So general nurses are going to have a lot more experience with psychiatric patients.
I mean, that's why I'd recommend the podcast for adult nurses, learning disability, any sort of field really, for that. So just 2 more questions. Have you got any tips for somebody, just 1 or 2 tips, key tips for someone setting up a podcast? What would be your 3 top tips, say, for example?
Number 1 top tip is make sure you press record. I've done that so many times. I've pressed the button and then forgot. You have to press it twice on this machine, and I've pressed and recorded this fantastic interview, and it didn't bloody record. So just make sure it's definitely recording. That's my top tip. I would say the equipment is not as important as the content. That's my main tip. So people get bogged down in like, well, what should I use? There's loads of stuff online. So loads of stuff, how do I record a podcast? And there's loads of interesting and really great things about how to record, but none of it is going to be as interesting as the content. So, it's great if you have good sound quality and you have a nice microphone, everything's brilliant, but it's far more important that you have stuff that you want to record. So that's the big thing. It's something you're interested in and you want to record it, because that'll get you through all the kind of tedium and boredom of having to edit and all that kind of stuff. So number one is get the content that you want. So that'd be my biggest tip. Number two is try and plan. I don't think I planned as well as I should have done when I was doing it. I kind of recorded one, released one, recorded a couple more. I was more keen to get it out than plan it slightly better. So maybe that'll be another tip, is maybe have 3 or 4 already in the bag, or maybe a series, if you're planning on doing a series. Because then you'll have more ready to go out. So I think I was a bit slow getting the next one out, and everyone was like, oh, when's the next one? And I didn't even have it recorded, so it was very tricky. So maybe, I suppose, how do I phrase that? Maybe not be as quick to release them. Hold back if you can. It is very exciting, but try and hold back if you can. And I guess the last one would be about promotion. So I would just message everyone. I was on Twitter and I was messaging anyone and everyone. And it has to be slightly annoying, and not in a rude way, but you have to just, kind of say to people, look, I've got this thing, why don't you listen to it? And kind of be slightly pushy.
Yeah. That's amazing advice. And I think you're right, that it's about not being shy. And, that's the thing that holds us back, isn't it? Because I was the same when I started the YouTube channel. What are people going to think? You can't, you just got to go for it. And, and I wouldn't have seen that podcast, your podcast, if you hadn't tweeted it out. We connected on Twitter, and it's just to get it out, use that social media, don't be shy. So it's really good advice from you, John. And then the final question, I think, because I get a lot of viewers on my YouTube channel that are early career or students, and obviously we've got lots of challenges in nursing, but this is something really positive. You're going to inspire so many people with your, with what you've achieved. What is there any sort of advice you could give, or some tips to anyone starting out in their career, a student that's feeling really demotivated, or an early career nurse that's finding it hard? Because I know you support a lot of students in practice as well.
So I get a lot of students, a lot of people on placements, and it is very tough out there. And I think people are really struggling, partly because of the way the nursing is going into government and all sorts of things, and it is very tough. And I worked in like I say, in the security, and it was very hard. And I guess the main thing I would say is try and take your positives and wins and focus more on them. It's very hard, but if you get one patient say to you, I'm glad you were here today, just hold on to that and try and keep hold of that, because you're going to go through an awful lot of stuff. But I still think the positives outweigh the negatives. It's a very tough job, and it's a very difficult place to work, and it's very hard, and it's a thankless task, but sometimes people will thank you, and people do appreciate what you do. And I think that really gets you through all the kind of tough times. This sounds really flippant again, but I had one patient say, John, are you in tomorrow? And I said, no. And she said, oh, so she was going to miss me tomorrow. And that kind of, just that little bit of kindness can get you a long way, particularly from the patients.
Yeah, it's really good advice. And I'd say thank you so much for your time today. You've given a lot of insights and a really good overview of how you started, key aspects from the phases, and just some really good advice, I think, and some positivity in nursing now as well. So thank you so much for everything you're doing for nursing as well. You're making a difference, and thank you for your time today.
No, thank you, Carol. I thoroughly enjoyed it.